afternoon, everyone, and welcome to SADAG's Teen Suicide Prevention Teachers Connect webinar. I'm really excited that all of you have been able to join us. I see lots of people joining the session, and I'd really love for you to introduce yourselves in the chat box. We'd love to know where you're joining us from, where you're connecting with us from. Please put your name, maybe your profession or which school you're from, if you're a teacher or an educator, or perhaps even just where you're joining us from around the country. We'd love to just make this in a physical distance world, a little bit more connected. So we'd love to know where you are. So please do post in the chat box. We'd love to see that. Just a little bit of webinar etiquette at the moment. Please keep your mics on mute. It just helps to avoid any interruptions. We want this to be as interactive as possible. So please post your questions, your comments in the chat box. I have an amazing team who are actually watching the chats, and we'll make sure that we're able to answer your questions or at least share information that could also help you. You're welcome to keep your camera on. It's always nice for our speakers and ourselves to know that we're actually speaking to people and not to black screens. So you're welcome if your network is good enough. I know where I'm coming from on the East Rand in Johannesburg, we're having a big thunderstorm at the moment. So holding thumbs that everything carries on. The webinar will be recorded. We will be sharing the recording link as well as copy of the presentation slides to everyone via email in the next 24 to 48 hours. We're also going to be uploading this information to our website for you to use in future, so you'll have all the information at your fingertips. This afternoon, we're going to be doing the program. We're going to tackle understanding teen depression with Dr. Frans Korb, who is our SADAG board chairperson, is a psychiatrist and a psychologist. That's not a typo. He really did study twice. So thank you very much, Dr. Korb, for joining us. He's going to be touching about the signs and symptoms of teen depression, also helping to differentiate the difference between a normal mood versus depression, and then what kind of assessment tools we can use for teen depression. We've also got clinical psychologist Alexa Sher talking to us about how do we actually talk about the hard topic of depression, giving tips and tools to teachers, some basic counseling skills, and even action plans for teachers, which is really important. I'll then end off with just talking about some of the teen suicide myths and the language we use around suicide, and then talking about a safety plan and how to get help. Before we come over to you, Dr. Korb, I'd like to just launch our first poll. We'd love to know and to hear from you. Is this the first time that you're attending a SADAG webinar? It should pop up on your screen at the moment. Or please tick if you've attended last year's teachers webinar that we did in September. Or if you regularly attend our SADAG webinars, it'd be really great to know that you're a regular. Or oops, I'm on the wrong webinar. But in that case, please stay because this information is still going to be really useful. So please do tick an option there. We'd love to hear from you. It's really great to see from the chat box. We even have some NGOs that are working with youth, so thank you. We have a lot of people out from Pretoria and Cape Town. There's even someone from Boksburg. I don't feel alone anymore. There's more of us. Also from Benoni, Pretoria North, Stellenbosch, Durban, really fantastic. So thank you to everyone. Okay, I think we've pretty much got everyone's poll in. It's really great to see that the majority of our people, 83% of our attendees today, 84%, are joining us for the very first time. So thank you. Thank you for taking the time for joining us today. And I really hope that you find this useful and beneficial. Perfect. I'm just going to keep those results. What I can do now is I'm going to hand over to Dr. Frans Korb, who's going to really get us set for the afternoon and introduce the topic of teen depression, the signs and symptoms. So Dr. Frans Korb, over to you.
Right, Cassie, I think I'm unmuted. Can you hear me?
I can hear you loud and clear. Thank you.
Thank you for inviting me. Unfortunately, as I've arranged with SADAG, I've got another webinar at 4 o'clock, so I've only got to the next 20-25 minutes to quickly talk about this and hopefully also leave a few minutes just for perhaps one or two questions. But just as introduction, there's been such a lot written about adult depression. I think often that perhaps we leave childhood or teenage depression behind us and not pay so much attention to it. But, in the last few days, I thought, let me just try and read up a little bit and see if I can update myself if there's something new about childhood depression. There isn't really anything new, except what they keep on saying is that they feel that the rate or the amount of childhood depression is on the increase. So I think that is something we need to remember. So that is the first point I want to make, is that please don't be mistaken that the amount of children and adolescents suffering from depression is on the increase. That's the first point they make. The second point that there's lots written about is that there are still so many people that believe that depression is an adult disease and not a child disease. But I think it's absolutely clear that childhood depression, adolescent depression definitely does exist. I think the main take-home message I want to get through this afternoon, as one of them, is that when a child has got depression, we need to absolutely recognize it and treat it properly. And the problem with that is, and why I want to stress it over and over and over again, is that we know that depression is a biological disease. Every time a person has got a depressive episode, it kind of causes brain damage. It kind of causes neurological problems. And with every depressive episode that a person gets, there's a high chance of getting a second episode. And if you've got a second episode, that second episode will be more severe, will last longer, and will also be more difficult to treat. So the point I'm trying to make is that if we don't recognize and treat childhood depression properly, we are almost setting these young people up for depressive episodes for the rest of their lives. So really, it is so absolutely important that whoever it is, teachers, I know we've got many teachers on board here this afternoon, but families, parents, everybody must recognize depression in children. But the main thing that I was asked to do is just talk about the common symptoms and signs of childhood teenage depression. Ultimately the symptoms are the same, but I think it presents a little bit differently in children and adolescents. In the younger children, most often they present with physical and bodily symptoms. It's vague aches and pains, it's restlessness, it is distress when the parents go away and leave them at home for an evening or leave them with a caregiver, that separation anxiety. It's often those kind of symptoms in the younger children that they present with depression. If I think back, often the older doctors that I used to work with in GP practice, they used to diagnose these children with growing pains. And I often think back and say, these children have been diagnosed with gross pains, how often those vague somatic symptoms were actually not really a kind of a red flag that these children might have some childhood depression. When you then get to adolescents most often present, sometimes they can verbalize because they're more able to verbalize their emotions and feelings, but they mostly present with irritability, anger, aggression, that kind of symptoms as a kind of a red flag that there is depression. Now, the main way we can recognize it is if there has been a change in a child's behavior. So if there's been a sudden change, if it's a child that has always had an interest in sport or hobbies or whatever it is, if they suddenly start losing interest in the fun activities they used to have, that is a kind of an indication that perhaps there is a depression. And now my phone rings. That there is depression, it's always Murphy's Law. So, that there is depression underneath. The second thing we need to be on the lookout for is the whole thing of withdrawal from usual social things. There used to be the social thing at schools. They've got all these groups and things they belong to, and that the adolescents tell me And if they start withdrawing, they don't part of the groups anymore. That kind of thing often is also a kind of an indication that these children are depressed. Obviously, if there is a sudden change in their academic performance, so the cognitive kind of symptoms of poor focus, poor concentration, they used to be an A student, and now all of a sudden this year, their marks are declining suddenly. So, any change in academic performance, concentration, focus is a kind of an indication. The next one that sometimes happen, but not that often, hopefully, is these children that wants to verbalize that they want to run away from home. Sometimes they do run away from home, or sometimes they just verbalize, I want to run away from home. I want to get away from these people. So that is the next one. Obviously, then, I think the most worrying one, seeing that this is just past Teen Suicide Week, is the whole thing about talking about suddenly death and dying, or the wish that they weren't here anymore. And often they make subtle comments about that. Maybe not so much, well, at school as well, I've picked it up where they've actually mentioned it to their friends, and the friends reported that they talk about suicide, what would it like be if I was dead, that kind of thing. Something I need to mention as well, and I mentioned it so often before, is that the internet is a wonderful thing. It's an absolute necessity, but these children, I don't know how many parents actually go onto their computers and check what websites the children go onto. But you can actually Google methods to commit suicide or methods to hurt yourself. And so often, if parents can pick it up, the children have been looking at those kind of websites or mentioning those websites to their friends and things that I've looked up suicide methods, and this is the way to do it. So that kind of thing, I think it's very important. And then there are the normal symptoms and signs of depression, a change in a person's sleeping pattern, where children often, in adults, depression often causes insomnia. In children, often it's hypersomnia. These children come home from work, they've got no energy. Every afternoon they get, instead of starting their homework and getting it over and done with, they would go and lie in their bed. That kind of inertia, that kind of amotivation kind of thing can also tell us that this is possibly depression. Children, change in appetite. Usually, and in adults, depression, in most cases, people lose interest in food, they lose their appetite. In children, adolescents, they often start binging. It's almost a kind of a compensation for those kind of mood symptoms that they've got. Then, of course, the agitation, aggression, irritability we've spoken about. And also then perhaps lastly, on a more psychological side, if they start talking about, I feel hopeless, I feel worthless, that whole kind of, all those terms that people describe about depression. So those are the main kind of symptoms, hopefully, that I just want to expand on or just get across on what are the symptoms. The other thing I really want to quickly just mention is marijuana, cannabis. So I know that is a big thing, and it's legal in South Africa. Every adolescent will tell you it's now legal. Don't tell me not to smoke it. But please, we need to know that children that smoke, first of all, it's what we call a gateway drug. So they start with cannabis, and that is the gateway to other more heavily using things. But besides that, often when they start smoking cannabis, it's kind of a cover-up for their depressed feelings. So that's the first thing we need to mention, is that kind of they started smoking cannabis because of the depressed feelings that is there underneath. The second thing I just want to mention about cannabis is that the psychological effect of cannabis is what we call the amotivational syndrome. That kind of lack of motivation, that kind of nothingness that happens in a person's mind from lots of cannabis smoking. And I think it's often very difficult to distinguish between the amotivational syndrome of cannabis and the true feelings of depression in adolescence. So that is a bit of a problem, and I think we always need to keep substances in mind. And perhaps I can just quickly, in the last 2 or 3 minutes, and at least we've got 5 minutes left for questions, just about treatment. Obviously, we, in all psychiatric things, we treat things from a psychological point of view, as well as from a medical point of view. from a psychological point of view, I think it's now very well established that CBT, cognitive behavior therapy, is the best method from a psychological point of view to deal with mood disorders, with depression. From a medical point of view, if it becomes more severe, obviously we can use medications. There's been a big controversy in America since I think it was about 2004 that they thought that, you know, antidepressants will cause suicide, will make suicidal ideation worse. It's never actually been proven, but in America there are 2 of the SSRIs, the common everyday kind of antidepressants that has been registered for the use in children. So there are 2 of them, and that is fluoxetine and escitalopram are registered in the US for children. Obviously, with children, we need to watch them when we start any medication. We need to watch them very carefully in the beginning and make sure that they are okay, and make sure that you know, because the antidepressants do take 10 days, 2 weeks to start kicking in. And so we need to watch children in any case when they go onto medicines, that they don't develop suicidal ideation or make symptoms worse initially before they get better. So I think that is a very brief overview, Cassie. So maybe we've got 2 or 3 minutes left to quickly ask questions if there is anybody that wants to ask. And you must come, Cassie, but maybe you can also chip in here, please.
No, absolutely. And thank you so much, Dr. Kolb, for that overview. And I think it also highlights from the different age groups, which I think was really useful, from children to teenagers. I know we've got some primary school teachers, we've got some high school teachers, so it's really great to have a look at that. And one of the questions we get asked often is there an assessment or a screening tool that teachers could use to identify symptoms of depression? Would you suggest anything that they could be using?
Yeah, you know, there isn't, yeah, there is. You know, there are these little questionnaires online, but 99% of them are really adult questionnaires. There is one questionnaire, which is the Columbia Childhood Depression Questionnaire, that is available, but that is one you have to buy it, unfortunately. It's not freely available. So, you know, and I think it's very important that you know, any questionnaire for that matter in psychiatry is not a diagnostic thing. It's just a screening tool. The main thing, and I think in children, is to listen, to be aware of the warning signs. That is of utmost importance. You know, once we do a questionnaire, it's almost a kind of, we've already think the child is really depressed. The questionnaire is really just there to kind of confirm the whole diagnosis. It's not to screen for it. I think the most important thing is to think about the kind of symptoms I've just spoken about, and to be aware of all those red flags that can come up, that we've spoken about, Cassie.
And thanks as well. I see some of the comments, you know, can anyone just buy the questionnaire? I think what we could also do as SADAG is we have a list of the warning signs that you've mentioned, or the different symptoms to look out for, from the behavior to the feelings. So what we'll do, including in the manual, is we'll include that list that people could use as a guideline, because I think it is very important what you also said, Dr. Kolb, about if you're coming to the point of having to do a full questionnaire, there's already been some red flags that have come up. And a lot of the info that we also say is don't wait to tick every checkbox before you do an intervention. You know, even noticing one could be the first step in getting early help for the student.
Yeah, I think that is I think from a teacher's point of view as well, Cassie, is if there are any of these red flags come up, please get somebody, a professional person involved. Get the school psychologist, get the psychologist that does sessions at the school, you know, get somebody involved. Don't wait for things to happen. So I think that is something we need to stress, Cassie, and I think that's something we stressed with our teen suicide week last week as well, is that if there are any red flags, please don't wait. Take action. Rather check it out and make sure, than let them have a suicide attempt, and that is the problem with teenagers as well, with adolescents. You know, often their suicide attempts are kind of a quest for help, but they misjudge themselves sometimes, and then they do actually do themselves serious damage. So that is really a problem. You know, the person that takes a bad overdose because mother's quickly gone to the shops, but then mother met another friend at the shops and went for coffee quickly and only comes home a few hours later. So, you know, please, and I've had those situations. Absolutely, I've had those situations before. So please, if there's any sign to take immediate action, that is really so important.
And we'll also be sharing some other tips and tools. I see some of the teachers are also asking, you know, what can you do if you do notice the symptoms besides just telling a teacher? We are going to come to those questions throughout the talk. Dr. Korb, I know you're needing to wrap up, but how many of the symptoms would be required to suggest that it is actually clinical depression and that they need to see a mental health professional?
Yeah, I mean, Cassie, there are the DSM classifications. There's the ICD-10 criteria that you have to have 2 or 3 of these, and it has to be there for at least a 2-week consistent period. I know that is there. But, you know, please remember that these criteria are really also just guidelines. You can't say if a person has got 3 out of the 4 criteria that they're not depressed. So we'll wait until you get 4 criteria right, and then we can say they're depressed. I don't think we should do that. Please remember that all these criteria are guidelines so that we all speak about the same thing ultimately. And they were originally designed for research purposes. So really, I don't think we should wait for a person to fall into a definition. If we are concerned about somebody, if we recognize any one of these symptoms, they are really important red flags that we should take action.
Absolutely. And thank you so much, Dr. Korb, for setting the scene and really just going through the symptoms. It's been incredibly helpful. And I can also say we have lots of different short videos that Dr. Korb has done around teen depression, around adult depression, even men in depression, which are available on SADAG's website, and we will be sharing them. Dr. Korb, I know that you're going to run off, but do you have any last words that you'd like to leave with all the people that have joined us this afternoon?
Yeah, sorry, I've just been trying to look at lots of questions coming up here. I wish we had more time to answer all those questions. Anyway, I think that my message is just really what I've just said, is that if we recognize any signs and symptoms, please don't sit on them. Report them immediately, get the child help. And then hopefully Alexa will now also talk about how to address, how to talk about depression with teenagers and adolescents. But don't sit on symptoms, especially not in adolescence. Get help as soon as you can. Yeah,
absolutely. Okay. Thank you so much, Dr. Korb. I really appreciate your time and your insight. A lot of the questions that we have, we'll also do like an FAQs page. There's some questions here about where do you find the law around the cannabis use. We'll get all of that information and make sure that we've answered all the questions, whether it be in this session or afterwards. So thank you very much, Dr. Korb. I really appreciate your time.
Thank you very much, Cassie. Sorry, I have to leave now.
No, please don't worry. Thank you. Thank you so much. I really appreciate your input. Just before we get to Alexa, our clinical psychologist, who's going to talk through the next part, is as part of the manual, we've also got these handouts and information on how to identify the warning signs or the symptoms of depression or suicide, which we will be sharing with you. We've also got tips of what to say, how to get help. And this is all the kind of tools that you'll have available. As mentioned earlier, it's so difficult to have a go-to assessment tool. And this is something, the SAD Person's Assessment, that SADAG uses within our call center that we train our volunteers on. And this is detailed. Again, it's more around adults, but a lot of it can be adjusted for adolescents. It's all kind of the same assessments or symptoms that you're looking out for. We even have a really simple suicide risk assessment scoring. And this is, determining, do I get emergency help? Do we need a hospital or an ambulance? Or do I just get them to a mental health professional as soon as possible? And sometimes it's always so difficult, especially when you're feeling that gut. And I saw some of the comments, listening to your gut and asking. But sometimes we're not sure if we need to be going emergency hospital route, especially in a time of COVID where we're not so sure about going to hospitals and clinics, versus do I get them to a mental health professional now? And I think this tool is really simple, and it's something that you can adapt and to use. So this will be part of the manual, as well as how the scoring works. And I'm hoping that also helps a bit. I'm now going to hand over to Alexa Scher, who is been with SADAG for many, many years, has done a lot of workshops for us and does talks on this. And it's just really, really vital in that practical tips and tools. Alexa, during her community service many years ago, was actually working with SADAG in our DIPSLIT counseling container and working really closely with the schools and the teachers in putting action plans together. So Alexa is a clinical psychologist. She does have a private practice. She is able to do online sessions as well. She's joining us this afternoon. Alexa, thank you so, so much for your time.
Thanks, Cass. It's really wonderful to be here and talking about such an important topic. And it's so wonderful to see how many people are participating today. I obviously completely reiterate what Dr. Korb was saying around, the importance of needing to be informed and understand what even is depression. What does it look like? How can we recognize it? And I think, the fact that you guys are all here today shows that you are endeavoring to really increase your understanding, and that's a huge first step in this process to supporting teenagers. I think that it's also so important to understand when we have these kinds of conversations around what is depression, for example, and what are the warning signs, is to remember that even though these are mental health issues that are experienced very widely and are very common, they present themselves uniquely. As we are all unique individuals, so too do we experience issues like depression differently. So you might find that you're looking for one thing and you miss it in a person because it wasn't what you were looking for. So remember that whilst what we talk about are general sort of experiences or symptoms or signs, that everyone does experience it in unique ways. I think that in engaging with teenagers, especially teenagers of today who are incredibly informed themselves, it's important to come from a place where you yourself are informed, because ignorance can lead to stigmatizing, even very unintentionally. And I think what's so important to understand is that if you're wanting to actually engage with young people around their mental health, you're almost doing more harm if you end up accidentally stigmatizing them if you had just done nothing in the first place. So really, really try to be informed, because, sometimes even with the best intentions, we can say things that end up actually making someone feel even more sort of judged or worse off than before. So, I always find that Google is a fantastic resource. If you're ever at a loss, Google it. I continue to learn so much when I just Google and find resources. There is so much online. Can really be helpful for you, because I think one of the experiences, obviously as a psychologist, but I'm sure for many of you as teachers too, is that the minute that you actually are, say, face to face or in a personal engagement with someone who is not okay and who is very depressed or suicidal, it can be very alarming. Now suddenly it's like, what am I going to do? Do I know what to do? It can be incredibly distressing when we have to sit with someone else who is so distressed. So just remember that you don't then have to have all the answers yourself. You don't have to know exactly what to do. That there is information available, and of course SADAG and us as mental health practitioners, we are all here to be able to assist you in these kinds of interactions too. I think something that is so important to understand is that, I think sometimes, depression, going from where someone's depressed or someone's just being maybe a teenager with mood swings, etc., is that, to dismiss maybe what someone is saying or expressing or how they may be seen, dismiss it as, you just pull up your socks, or, just get over it, or other people go through much worse, can often be a mistake, because when someone, for example, maybe does harm themselves or does sort of seem really down all the time or aggravated, and what's the point in anything, is that those actually could be your indicators that something actually is wrong. And if someone is not okay, that's okay. They don't need admonition. They don't need judgment. They don't even necessarily need to be told what to do. Maybe just to be checked in and say, how are you? Where are you at? And to pay attention to that, because they might actually need more support than anything. I think what's also very important to understand, especially from the point of view of dealing with adolescents, is that whilst they are very mature and educated, their brains have still not fully developed. So their patterns of thinking are still quite polarized. And then depression and mental health issues exacerbate this. So instead of being able to see the gray area, which as adults, we have the capacity to do, it's very likely that teenagers see things in all or nothing ways. Things are fine and everything's amazing, but then you fail a test and it's like everything is terrible. My life is over. Especially like around this time when we're talking about failures with matric and things like that, and a single incident won't necessarily be considered as just one out of many for a young person, but they might see it as all this is now everything, and it can be difficult to gain perspective because again, it's not just an intellect thing; it's an actual like brain neurodevelopmental capacity that not all young people have developed yet. And the same with being able to actually think about the consequences of their action. Teenagers have not developed that capacity yet, which makes a lot of sense as to why they sometimes make the decisions that they make, considering, to an adult, it's so obvious what was going to go wrong. But if you don't have the neurological capacity to think in these ways, and then you have depression or anxiety or one of these mental health issues which directly impact the way in which you think and the way in which you manage your feelings, you can easily find that person then loses control of their behavior. And of course, teenagers are a bit impulsive. So all of that mixed together can result in them needing intervention and support. And so I suppose when it comes down to then, okay, well, then how do we support them? So informing yourselves, yes. Another thing I think is important to understand is to understand what is actually at play in mental health in general. Cassie, can I share my screen for a second? Okay. So what I always do with my clients in session, now that I've said it, I don't have the image up. I'm going to get it up now, sorry. When would I describe depression or just mental health in general, rather, to my clients, is using this image, and this is a very Dr. Korb mentioned earlier about cognitive behavioral therapy as being a very effective tool in managing depression, and this is a very cognitive behavioral therapy way of thinking about mental health. So you really, it all spills into itself. So the way in which a teenager thinks about a situation will then directly impact how they then feel and what's happening in their bodies, and that will then go on to affect how they behave. And so when you've got a teenager who's already is limited in their brain capacity to think fully or in a nuanced way, you've already got that all or nothing thinking, and then you've got depression on top of that, which is maybe exacerbating that all or nothing thinking. It can become very difficult for that person to then actually tell the difference between, well, what thoughts are actually true and what thoughts aren't necessarily true. And I think even as adults, I know myself, we all struggle with this. We have a thought and we just take it at face value. We don't even sometimes realize all the thoughts that are going through our heads at any given time. And I think it's really important to understand that for teenagers right now, they are flooded with so many different thoughts because we're all being impacted by many challenging situations. Plus, you've got online world and the amount that they are taking in, it can be very difficult to start actually being able to figure out what's true, what's not true, and to not get influenced heavily by some of these thoughts. And as Dr. Korb said, types of thoughts that kids can be, or people with depression can be left with, are often very much related to, hopelessness, what's the point, meaninglessness. And then I think especially for young people, which is so important, is real concerns around the responsibility and the effects they have on others, not wanting to create more stress, say, for example, for their parents, having a heightened awareness to what people are going through and then not knowing how to cope with that. Thoughts around death. I wouldn't be having to deal with all of this if I just wasn't here. Perhaps thoughts like everyone hates me, people would be better off without me, I'm a burden to others. These are very, very common thoughts that people with depression can experience. And then obviously, thoughts that I think that's about thinking that you don't belong, thinking you're a burden on others, and kind of having a sense that that's not going to change. And that the only way to then deal with that is if you weren't around. It can be very easy to then go to a very simplified, oh, well, because, I'm no longer in that friendship group, therefore I'll never have friends again. And therefore, if I'll never have friends again, what's the point of living? And so lots of jumping to conclusions, making connections in their way of thinking that can be, can have a huge effect. I mean, if you think that no one loves you and that you're a burden and people will be better off without you, of course you're going to be feeling down. And so I think what's so important for you, and if it's one thing that you take away from what I've shared with you today, is to recognize that telling someone, don't think like that, don't be sad, you're not a burden, we all love you, don't be stupid. That's not going to work. As much as you might, again, have the best intentions and are trying to maybe show someone, but look, we love you, you're important, or you can talk till you're blue in the face. It wouldn't be depression, it wouldn't be a mental health issue if someone just telling you that their love takes all of that away. Then they would just be having a bad day. So I think when it comes to something like depression as a mental health issue, the way in which we see that is different to, just normal mood swings is that the person can't necessarily not think the way that they're thinking. If they could just change the way they were thinking, they wouldn't have a mental health issue. Same with the feelings. If they could just, say, just don't be so worried, everything's going to be fine. If that was possible, they wouldn't be sitting there having that conversation with you in the first place. And I would imagine that some of you can relate to this yourselves, because we would all think differently and be a lot happier as human beings if we had control over what we think and what we feel. As a psychologist, my approach is really that we don't have that control. And the more we then focus on, I shouldn't be thinking this, I shouldn't be feeling this, I wish I wasn't thinking this, I wish I wasn't feeling this, the more we focus our attention on those things, the more we're focusing our attention on something that we have no control over. And the more we focus on something that is out of our control, the more overwhelmed and distressed we become. And so what I like to do is say, look, especially often because the situation that people are in does actually mean, these difficult thoughts and feelings, especially with COVID now. It's very difficult to turn around and say to someone, oh, no, you can't think like that. That's not true. Because actually a lot of the situations these kids are in are filled with difficulties. And so I really try to normalize what they're going through. If I was in that situation, I would really imagine that I also would be thinking that no one loves me. And that sounds like it would be really upsetting, really hurtful. So normalizing and reflecting back, what are you hearing them actually saying? And then to focus on the fact that, okay, well, you know what? Because it's understandable to think and feel like that in relation to that situation, or because you are thinking and feeling that way, let's not focus on that, because you can't help that, but let's focus on how you react to those thoughts and feelings. Can we look at those thoughts and feelings and see, is this true? Or is this fair to yourself? Is it fair to say that no one loves you because or is it fair to say that you fail at everything because you actually did pretty well in that last test? Oh, I suppose. So maybe you're not failing at everything. Helping them to think about the thoughts, not just telling them not to have them in the first place, because that they cannot control. So really, really helping them to shift their focus on how they're reacting to their experience. And this is where the way in which you react to what they're saying is so vital. Because if you wanted to help them manage their depressive thoughts, for example, if you react to those thoughts with judgment yourself, it's going to be very, very difficult for them to not do the same. As parents, as teachers, as adults, we have to model the behavior we want to see in younger people. So if you are trying to help someone not get more depressed, telling them that they're being selfish for even thinking about suicide, for example, isn't going to make them less suicidal. In fact, it's going to be confirming of what they already think, which is that I'm useless and you would be better off without me, and I just hurt people or whatever. So you wanting to model what it would look like to not judge, be like, I can imagine it's really hard to sit thinking that no one really likes you. I wonder, and then you can maybe think about that with them, but without judging, and maybe saying, maybe relating it to a story that you have experienced, or just normalizing and say, you're not alone in that. I think lots of people are also left feeling like that, and it's really hard. I think sometimes even in like attending a workshop like this today, and I certainly have had to navigate this with being a psychologist, is that, you know, when someone comes to talk to you about something like this, we can easily immediately assume that, well, therefore I now have to help them. I have to do something. And that in itself can be distressing and overwhelming, because what to do? And I think especially in a country like South Africa, especially in certain communities where there really, really isn't much mental health care available, it can feel very, they're feeling very helpless. And as human beings, when we feel helpless, that's very uncomfortable. We like to be in control. And so sometimes what can happen unintentionally is we almost are frustrated or sort of like pushing away of this person that's approaching you, because it's easier to like not have to deal with it than to sit with the distress of what to do now in the situation. What's helped me immensely to sit with this feeling of helplessness is to realize what actually help looks like, and that it's not necessarily what we assume it to be. You know, we can't actually always help someone not be depressed. Again, if that was possible, they wouldn't be depressed. We can help support them in that process so they're not doing it alone. You know, and obviously there's some of us who try and help people with depression as psychologists and psychiatrists, but I mean, as teachers and things like that, you don't have to have the answers. You know, I certainly don't have the answers for many things in life, but I listen and I give people a space to just share. And that doesn't always necessarily feel effective to me, but it certainly is for someone. I don't think you can ever take for granted just how meaningful and important it is to someone, have someone listen without judgment and listen attentively, not listening whilst thinking of the next thing that you're going to say, or listening whilst immediately planning how you're going to refute what they're saying, but to really just listen and be like, wow, if I had all those thoughts in my head, you know, I would also really feel down. That sounds really hard. You know, validating their experience. So often we unintentionally invalidate people of saying, yeah, you know, but at the same time, there's a lot of other people that have it a lot worse than you know, or yeah, but like, you should also be very grateful because, you know, your parents, you have such loving parents. And, you know, again, you're coming from good intentions, but what you're saying is that person shouldn't be feeling how they're feeling. And that's very invalidating. And immediately it can leave that person thinking, you know, you're right, I'm a bad person for not being grateful. And then it just kind of reconfirms that bias. So again, you can see how easy someone can go around and around in this type of a cycle and get very stuck, almost confirming and fulfilling these prophecies for themselves. I'm trying to think what else to share. You know, I think so validating the experience, normalizing the experience. You know, sometimes, especially for example with COVID, we've all been thrown into the deep end. No one has experience in dealing with the pandemic. And I think over the last year, what I found to be really effective for people is for them to realize that they're not alone, that, oh, you know, other people are also struggling to focus and pay attention and have motivation. You know, it doesn't mean that suddenly just because, you know, other people are struggling with the struggles go away, but they can be less distressing. So again, as human beings, you know, we do get left with difficult thoughts and feelings at times. That's part of what makes us human. It's not about not experiencing those difficulties, but about, you know, at least not getting distressed by the fact that they're there. When you don't focus on when you try to control, oh no, this is here, it mustn't be here, you then continuing to focus on what you can't control, and there's the distress. So even just by normalizing something, it doesn't take that issue away, but it makes them less distressed. And when they're less distressed, then you can look at, well, what can we do to like actually cope and manage with these things? So I always say to people, you know, I'm not a magician. I can't take away your difficult thoughts and feelings. If I could, I'd be a millionaire. Or I wouldn't have a job because people would know how to do it for themselves. So it's really just about saying, look, it's okay if you're not okay. Instead of focusing on the fact that you're not okay and getting distressed by that, let's focus on what you can do to help yourself when you're not okay. And so by modeling the fact that you're not judging the fact that they're not okay, they're human. And you can show them compassion in those moments. You know, when it comes to showing compassion to others, we can often be better at it, but when it comes to showing it to ourselves, we're not so great. But it's really important in these moments, especially with teenagers, to model that for them and say, I can see you feeling really bad right now, but is it helpful to judge yourself or get angry at not being able to finish your homework? I mean, it sounds like you've really been going through a lot. I wonder if maybe, what would actually be a helpful way of reacting to yourself, or what do you need right now? Maybe you need a bit of support. Maybe you want to do your homework with a friend. Maybe would that be helpful? Or something like that, showing them how it's possible to be compassionate to themselves. Yeah, so I think that, like, really trying also not to punish or threaten them. When the topic of suicide comes up, it can be very alarming. I have a teenage client at the moment who mentioned the other day about a previous suicide attempt. And obviously, at any point when that comes up, I do feel worried, and I do get anxious, but I wouldn't be a very good psychologist if I immediately went into alarm mode. So I didn't, and I listened, and we spoke about it, and we discussed a suicide safety plan so that she doesn't end up engaging in those behaviors again, which she was very open to exploring with me. And one of the interesting responses that I received from her after that conversation was, wow, it was actually really refreshing to get to talk to an adult about this without them completely freaking out. And I kind of internally laughed because I was freaking out. But it made a huge difference for this teenager, because she said that her and her friends joke about that, like even just mentioning suicide around a teacher or parent, and they will sort of freak out immediately. And now, if you've got a teenager who themselves is actually not coping, the last thing they need is your stress on top of what they're already going through. And so, whilst it is obviously a very distressing topic, it can help to really just actually say, you know what, suicide is something that people who are depressed experience, and understanding that there's a big gap between thinking about suicide and acting on it. And a lot of people with depression think about suicide or think about death. And I think what's important is that we pause before being alarmed, like that this means that they're going to do it, and actually sit and let them a space to talk about it. Because preventing suicide, talking about suicide is a way to prevent it, giving this person the opportunity to just express themselves. Often they can maybe get left thinking, actually, like, I feel a lot lighter now. And so even though those thoughts I know will come up again, I'm not at that point where I'm worried I'm going to act on them. That in itself, just listening without that judgment and helping them identify what's going to be helpful when these urges go up again. So trying not to panic, trying not to punish them or threaten them. Well, if you mention this again, I'm going to tell your parents, because that can just push them away from coming to talk to you again. And that's what we don't want. At least it's very tricky to navigate something like suicide with adolescents, because often they don't want their parents to know, or they don't want anyone to know. Suicide cannot be a secret. So, at least an adult somewhere has to know. And again, obviously, if you think the risk is high and that they are going to act on it, of course you have to inform their parent or caregiver or a social worker or the school psychologist, or finding someone to assist, SADAG included. But again, sometimes that person actually just needs you to listen and to be that person for them, that if they feel like they're not coping, they can maybe come to you again. I'm very aware of the time. But, Cassie, I do have a suicide sort of prevention safety plan that I thought I could quickly share. Is that fine?
Yes, that's perfect. And then I can pose a couple of questions to you if you don't mind. Yeah.
Perfect. So how I often engage with clients is just really illustrating that thinking about suicide, you can't control that, but you can control on how you then react to that thought. And instead of just having that thought play out and affect the way you feel and take control of your behavior, let's pause and think about that thought. So why are you thinking about suicide? Oh, well, because it's the only option I have. Is that true? Are there maybe other options that it's just difficult to think about right now? I'm wondering, and I think it's also so important for kids to understand, again, especially because they don't have the cognitive capacity to really fully think through the consequences, is that suicide is a very permanent solution to what's actually usually a very temporary problem or temporary experience. But feeling suicidal, feeling depressed is not necessarily, it's not always going to stay up at the top like that. It will come down. Sometimes the person needs to give themselves and you as their support enough time to allow it to come down and not just act impulsively when it's up there. But expecting someone to not act impulsively when they're up here in terms of their depression or distress is not so easy, which is why it can be helpful to have a pre-discussed plan in place so that if they find themselves in that moment, they can just refer to this plan and the steps are very clear and very easy to follow. So I'm going to share with you now just a template of what I use with clients at times. And I always make it unique to the client, but really, I mean, a silly little quote, but I think powerful in that if you're feeling like giving up, remember all the reasons you've held on for so long. So again, what depression does, what mental illnesses do, and what being a teenager can happen is when you have this way of thinking, like nothing's right, everything's bad, it's never going to get better, you end up just being like in a tunnel vision. And you can't see the other perspectives. And what you can do as someone to support them is to just help them go from there to there. You know, when people are sitting with all their thoughts and feelings inside, it's like all the thoughts and feelings are on their eyes and they can't see clearly. What you want to do is help them, give them space to express it, and then you can look at it together and say, okay, well, let's look at this thought. Is this thought true, etc. So helping them to also focus not just on all the problems, but also on seeing, you know, just how strong they've been this whole time when they haven't acted on those thoughts, and all the reasons why they are wanting to stay here, and not just focusing on all the reasons why it would maybe be better to not be here. Perspective taking is really helpful. Urge goes down. So if you're not sure what to do, follow some of these steps. So it can really help also to share with teenagers that they know their own warning signs. You know, if they can identify what situations or thoughts and feelings trigger them to feel suicidal, they can then immediately start learning to notice when they're in that space, then engage in these helpful strategies that you've shared with them. It's always so important to contact someone. Okay, it's really, really not great if you're on your own, because it's very difficult to get perspective when you're on your own. And those feelings and thoughts can quickly cloud your judgment and take over that behavior. So my first point of call is always to contact someone. Obviously, as people psychologists, I either provide my own details, SADAG, or unfortunately for SADAG, I mean, they always are getting my referrals too, and they're a great resource for that. That's why they exist. And not just saying call SADAG, but provide the number on the plan for them. They need to have everything at their fingertips for how to cope, because in that moment, coping is what seems very out of reach. There's also an app called My3, which I think is free, and it's made specifically for this, identifying 3 contacts that you know you can contact when in that suicidal space. And you know, this isn't something for everyone, and also what I always share with my clients is like, take what works for you, leave what doesn't. Again, it's not one size fits all, but these are just some suggestions. So, you know, if they could even make a list of reasons for why they are living. You know, maybe they can do that when they're feeling stable, and then in these moments when they're very distressed and feeling like they can't cope, they can refer to something like that. And it doesn't have to be a long list. It doesn't have to be anything significant. It can be my plants. It can be, you know, oh, I need to hear for a friend when they are going through X, Y, and Z or whatever. Generally, people do have more reasons than they think they do. And then it can help to actually have a list of things to do to feel safe, comforted, and calm. So I've given a lot of options here, but you know, again, it can be so great to rely on apps, because nowadays that's what teens and kids relate to. So, you know, if you feel like they're not what you have to say isn't being heard, you know, even just providing them with app ideas can be huge. I do this with clients, and it certainly leaves me feeling reassured that there's that extra level of support that I have a strong feeling that these teenagers will engage in and relate to. So there's an app called Calm Harm, which is really great and gives a lot of ideas for how kids or how people can just distract themselves or comfort themselves in those times of distress, to then bring it down. Once you've been brought down, it's a lot easier to think a bit more rationally and things like that. So coming up with ideas of how to distract in a healthy way, and how to express and let out the thoughts and feelings, but again, in a helpful way. So often people engage in self-harm because that's the only way they've identified that actually works in terms of feeling a release of feeling. It's not a healthy way, and it's not necessarily helpful because yes, it might work in the short run, but then you've got the scar on you or you hurt yourself. So bring them alternative ways of expressing and letting it out. Drawing, art, singing, music, dancing, exercising, journaling. All of these things make a big difference. Screaming into your pillow, punching your pillow, like let it out, just in a way that's not going to leave you harmed. And Calm Harm gives really wonderful ideas, and it's also free. Of course, one of the main things to prevent suicide is making sure that anything they could use is unavailable. So like Dr. Korb said, you know, sometimes kids can be so impulsive, they'll go and grab those pills, take them thinking it won't be that bad, and it could be, if they don't even have access to those pills in the first place, it's made a big difference. So, you know, and I had this conversation with that client the other day who I mentioned earlier, and she messaged me that evening and said she gave the pills to her stepmom. So, you know, what you think sometimes they won't be willing to do, you often be surprised sometimes they really are. So that's a huge, huge one to focus on. And then just, you know, that they need to also remember that just because they're having a thought, it's not necessarily true. Sometimes our thoughts can be our own worst enemies. What else? There's also DBT. So DBT is a similar therapy to CBT, but it's DBT. It's a bit different. And there's these distress tolerance skills. Again, if you Google it, you will find amazing resources online. And again, even if you're wanting to equip yourselves with ideas to suggest to kids, or if you're wanting to refer your students from there, you know, DBT distress tolerance skills would be amazing because they really are specifically designed for managing kinds of distress. Practicing self-compassion, and again, yourself showing that compassion to them. When we're not okay, we only ever need more love and support. We never need judgment or, you know, admonition. And then them not being alone. It's, you know, they might not want to tell someone what they're going through, but they certainly shouldn't be alone. Even if it's with a friend or with a family member, that person might not know what they're going through, but if they're not alone, at least there's less chance of them acting on it. Okay, I'm going to stop because I can talk for hours, and then I'll answer some questions.
Oh, we can definitely relate to that, Alexa. We can talk on this. And I think what's so great with having so many new people join us this afternoon, please know that this is such a complex topic that there's so many layers to it. There's so many other webinars that need to happen. So this is really just an introduction and just really working on it from next webinar to next. But I think an important point that was also raised is, you know, a lot of the stuff we're talking about, we're kind of need to also address the fact that there's a lot of students and learners who are coming from disadvantaged backgrounds, really impoverished communities, where they're worried about, you know, child-headed households and how to get food and how am I going to look after my siblings, and they're dealing with abuse and trauma and rape. And I know, Alexa, we work very closely in the schools in Diepsloot because there were a lot of these kinds of issues that were happening. So when a learner would come with depression or suicide, or they were dealing with problems, it's having to really kind of problem solve all those different issues. And I think, you know, as a human and as a teacher and an educator and someone who wants to help teens, we often see the problem and think immediately quick solutions. We want to fix the problem. And sometimes it's having to start it in stages. And I thought maybe you could just touch on, you know, when you're dealing with a teenager or a learner in from a rural or an impoverished community where they're dealing with these kinds of real psychosocial issues, how do we then also tackle it? And how do we speak to them and help them from that perspective, if you've got any insights?
Yeah, you know, it can be incredibly overwhelming when you're trying to help, but you realize that there's so many factors that are out of everyone's control, such as poverty, abuse, just endless list of issues. And then that can be so overwhelming that you almost then don't want to, like, you feel like you can't help at all. But it is about like coming down to the basics again and remembering that you just being there, the fact that this person has come to you in the first place, it's huge already. And, you know, it really depends. I suppose that's quite a difficult question, but I would say like reaching out to support networks, trying to address an issue holistically is important, because obviously you can try and do what I've suggested today, like validate and show compassion, but if they're going back into that really terrible environment, it's not going to really touch sides. So, you might find that you need to get a social worker involved. Again, I suppose social workers are often so overworked, not available. If you can get a social worker to get involved, especially if you really are concerned about sort of the social issues that this child is facing at home, or at least like to get advised. Gosh, I think that not all clinics have mental health care practitioners, but some do. So, find out if the local clinic in the area does have a psychologist or a psychiatrist that comes every now and then, or even if it's a lay counselor, find out what resources are available near you, so that if you feel like you cannot cope, you at least can refer. I think what's so important to understand is that it's okay to have your own limitations. And I think I imagine what's often really difficult for teachers is that you already are going way above and beyond, and you're at your limit, and like giving another thing, especially when it comes to mental health care, it's heavy, and now giving you another thing, we'll also be their psychologist, that can be too much. And so it's not about saying you have to be their psychologist, but it is really important that you can act as a bridge to at least try and assist them in getting that support that they need, even if at the least you can do is say, contact SADAG, and then they can kind of outline some of these other options. But to do nothing is definitely shouldn't be an option. And even if that thing that you do is to listen and not be judgmental and try to say, look, I hear that it's really bad, and and you can say sometimes, like, I wish I could change these things for you, and again, normalizing, like, that's what's so hard about life, is that things aren't right, and that people do bad things, or that life is messed up. And so, often what I think people who get helpless and don't know how to help is sort of saying, it is what it is, deal with it, that's life. Now, I don't think there's anyone better who understands it than people who live in some of the really, really terrible conditions in our country. Like, they know it is what it is. They know that life is not fair. And sometimes at young ages, that's deeply upsetting that they already have such views on life. But what people don't often understand, or what they sometimes mistakenly suggest, is that because it is what it is, because that is the situation, therefore get on with it, don't have difficult thoughts and feelings. But that's not so possible. It's like saying to a person, put the square into the circle. It's not going to fit. If the situation is what it is, then of course they have difficult thoughts and feelings. That's what makes them a human. So, taking that approach of acceptance, sometimes we do have to accept that life is hard and that there are things we cannot control. But that means we have to learn to accept that there are going to be difficult thoughts and feelings that come with it. And can you just find helpful ways, just let them out, that you don't just get filled up with them. It might not seem like enough. But again, I promise you, it really makes a difference. I really pursued the route of acceptance and commitment therapy during my community service year when I was working in clinics on the East Rand, because it made me feel less helpless. By coming, I can't come to someone and say, look, you should just try and be positive. That's not going to make any difference. But coming and saying, look, this is a bad situation, and I accept that, and I accept that because you're in this situation, you are angry and you are depressed, and you do think that ending your life is the only thing that makes sense. I get that, and you can't help that, and I can see that. But because that is the situation and we cannot control it, let's not focus on the fact that you're left feeling and things like this, but let's focus on what's going to help you manage and just cope day by day by day by day. And when you bring the focus down to, like, can you just get through today, it suddenly is often like there's a lot more space for that person to be willing to say, well, I can do this thing and I could do that thing. And again, like, obviously these apps and things I suggest are not necessarily accessible to many, but being able to distract yourself, being able to soothe yourself, we can do that with our senses. Focusing what can I hear right now? Instead of focusing on my thoughts, can I go outside and just try and just focus on all the colors I can see, or etc. etc. it's about being creative and collaborating with that person. So I don't have the answers, but maybe we can think together what you would find to be helpful when you are feeling so desperate in those moments.
Absolutely. And I think what's really great is just already with people posing questions and situations that they've dealt with, there's already people sharing in the chat box what they use, what has worked, journaling, play therapy, and all these questions are really so important. And I think, coming from SADAG's perspective, which we're going to touch base now on the action plan and, the resources available, is that often we're so used to going to teachers and they wear so many different hats, right? The school place, they teacher, nurse, counselor, parent, often action plan, superhero, all these different terms that they have to do. And often we carry that responsibility. And I think it's about when you're dealing with a student or a learner or a family who doesn't have a place to stay, doesn't have food, is dealing with all kinds of really difficult situations, it's never going to get fixed or solved in one session or even just one interaction. If a learner has come to you and you know about the situation, I think, again, just starting with finding out how they're feeling and saying, and I think, again, it comes again to validating, like, I see you, I hear you, and how you're feeling matters. And let's get an action plan together. And again, you don't have to fix the problem yourself. You don't have to fix it as one person. There's that old South African song, make the circle bigger. And I'm going to really unpack on how you could make your circle bigger, is that it's sharing that responsibility and it's building that team. We hear this African proverb all the time about it takes a village to raise a child. You as a teacher, you're not their only village. It's finding those resources. And that's, again, where SADAG can come and help you. We have a nationwide referral guide that can give you some of those resources. And that's the kind of stuff that we want to unpack. Alexa, there's so much that we can talk about, and the questions in the chat box are really amazing and they're so important. And I want to just get through to the section about resources and action plan. And then from there, we could possibly answer more questions at the end. But I can tell you now, all these questions we're going to make into a handout and share with everyone, because there's really valuable input and resources that we have available for all of them. So Alexa, if you don't mind, if you can stay behind a little bit, you're welcome to have a look at some of the chat boxes, but we'll definitely come to them at the end. Yes.
Can I say one last thing, which is, again, in illustrating how to refocus the perspective, often what I'll say is, even just, especially when it comes to suicide, it can feel quite hopeless, and you're almost running out yourself of what to suggest, is just also pointing out that, well, the fact that you've come and spoken to me, it must have taken an enormous amount of strength. And I'm really impressed by the fact that, you've even chosen to share with me. I really appreciate that, because I recognize it's really hard. And again, just acknowledging that activating your support network is hugely important, because whilst they can't take away their difficult thoughts and feelings, they certainly can get support in experiencing them. So teacher, counselor, friend, cousin, whatever, but it's like them coming to you in the first place is them activating their support system. And that is the sign that you're looking for, that they don't necessarily want to act on their suicidality. When you've dealt with people who take their own lives, there are some people who nothing was going to help them. And so when you have someone who's coming and talking to you about it, it's a great sign that they maybe are willing to get help and do something about it. And reflecting that and validating that and say, I'm reassured that, you've come and spoken to me today, and that already says a lot. And let's kind of give you more things to do that can help you. So there we go. I'm going to stop. Thank you so much for listening.
Thank you so much, Alexa, and thanks for all the insights. I really do appreciate it. And I love that it's getting the conversation starting. And I really appreciate that. So I'm just going to go through, again, using the language, and I know that a lot of people were also commenting now in the chat box about how do we talk about mental health, how do children talk about it, and that our teenagers don't always have the language to express how they're feeling. And it's so true. We don't bring up small children telling them about what sadness feels like, and that it's not just feeling sad, but it feels physically and it feels emotionally, and it's finding different ways to describe how they're feeling. And that's something, whether it's parents, parents, teachers, we have to do more of, is giving children tools on how to express how they're feeling. Something that we also do at SADAG, and I'm also a human and we're learning all the time, is the language we use around depression or suicide. We don't say, oh, there's a depressive, or there's a schizophrenic. We say there's a person with depression. There's a person who has schizophrenia. And I think when we're talking around suicide, the way we break the stigma and the way that we normalize a normal conversation around this, where you can have this around the dinner table, you can have these conversations in the classroom and not be scared of this heavy topic. So some of the tips and tools around how we talk about suicide is we often in our society and how we've grown up and over the years is we refer to as someone has committed suicide. And we see this in the press and media all the time. That person wants to commit suicide. Suicide in South Africa is not a criminal offense. So by even just using committed suicide, you're saying that the act of depression, the act of suicide, feeling so helpless and so hopeless, is a crime. And I think what we should rather say is that they took their own life or died by suicide. We also often hear of, oh, there was a successful suicide or an unsuccessful suicide. And I think it kind of suggests successful means something good. It means you've achieved something. And when we think of what the outcome is of a successful suicide, someone has died. A family has been devastated. Someone has lost their life. And that's not a success. That's not an achievement. So rather reframing it to say died by suicide, an unsuccessful suicide is actually a good thing, because it means that the person hasn't died and they're still here and we have the opportunity to get them help. And that's a really good thing. When we speak, we've often also heard of failed suicide. Again, someone who's tried to take their life or end their life, but perhaps the method didn't work or they didn't die by suicide, is actually a good thing, because it means that they're still alive and we still have a chance to get them help. So rather to say a suicide attempt. So these are just some of the languages that we can use. Again, it'll be part of the pack. So hopefully you can print these out and put it around your staff room notice board, put it around your volunteers or teachers and kind of spread the message. Because if we start changing how we're talking about depression and suicide, we can change how people see it and make it more normal to talk about these things and early intervention. Some of the common suicide myths that we've seen for when we go into talks pre-COVID, when we're able to go to schools and speak to teachers and speak to learners, is that there's this myth that if people talk about suicide, they won't do it. Now, in 75% of cases of people who have died by suicide, they give off a warning sign, they tell someone first. So someone talking about it is actually their way of saying, I'm not doing okay and I need help. So when you have someone who is talking about it, and we often hear this cry wolf, someone who keeps threatening or using it as attention-seeking behavior, something must be seriously wrong if someone uses suicide or wanting to die or thinking of dying as a way to get attention. And I think that's, again, another red flag that we should address and say, hey, I'm really worried about you. You keep talking about it, or you keep posting about it on social media or on your Facebook page. Is everything okay? This is one that we get a lot, is talking about suicide makes people more likely to kill themselves. You know, planting the seed. If we talk about suicide in our classrooms or with our children, we're going to make them want to kill themselves. And this is actually absolutely false. There is so much research around the world that says if we talk about it, we actually have the opportunity to save lives and to get someone help. However, by not talking about suicide, it could actually lead those suicidal thoughts to actions, and people could actually take their life. So again, getting used to talking to our teenagers and children about depression, about sadness, about having these thoughts of suicide or wanting to end their life. Trust me, if you're not having that conversation with them, they're finding this information elsewhere. So yes, please do talk about it. You're not going to plant the seed. People who attempt suicide are just trying to get attention. Again, it must be pretty serious if someone is talking about it so much. And, you know, we deal also a lot from the line of work that we do in the situations where a teenager has died and a family has been devastated, a school has been distraught, the class, friends, teachers. We always have this recurring comments that families and friends always say is, what if I had done something? I should have done this. I could have done this. And by taking every suicide threat or mention seriously, we have the opportunity to get help before it's too late. Only teens who are depressed attempt suicide, and that's not the case. We know that depression is the leading cause for suicide. However, we also know that there's normally a combination of issues that come together to make a teenager feel suicidal or even think of taking their own life. It could be a bunch of different issues like psychosocial issues, a breakup with a boyfriend, parents getting divorced, just failed their exams. We also know, and this was a comment that came in the chat box around suicide being glamorized. We also know with the matric results coming out that there's a lot of press and media about increased suicide rate. And that isn't necessarily the case. There is no spike in the number of suicides around the matric result period, or even when the results come out for every other grade. We see the same amount of calls coming from matrics and every other high school learner from the beginning of the year to the end of the year, because there's so many different contributing factors that could make a teenager feel like suicide is their only option. Suicide is not preventable. If someone is thinking about suicide, they will end their life eventually. And that's not the case. From the work that SADAG does, and we receive over 1,400 calls a day from people around the country who are feeling helpless and hopeless. We run the suicide crisis helpline, and we have lots of people who feel like this is their last chance to get help. And through getting intervention and help and support, there are lots of people who survive and get to lead very successful, happy lives. So suicide is absolutely preventable, and we're able to get that help for them. Some of the things I'd like to share today are these simple tips and tools. And one of the campaign messages behind our Teen Suicide Prevention Week is ask, listen, connect. You don't have to be a mental health professional to know which DSM criteria to follow or which assessment guideline you have to have. You don't need to know how to do a 45-minute therapy session for 4 to 6 sessions to be able to do something to get someone help. And it's just about asking the right questions, asking and following that gut feeling. If something feels wrong and if something has red flagged, something has made you feel uncomfortable, or a comment has just really stuck with you, ask. The worst case scenario is the person could say, no, actually, I'm really okay. Please don't stress about me. I was just having a down day. Or they could say, actually, yes, I have been feeling really down. So I think trust your gut. It doesn't hurt to ask and to openly ask. I'm really worried about you. I've noticed that you've been saying this, or you've withdrawn yourself from your usual family circle at school, or you're sitting by yourself a lot during lunch. I'm really worried about you. Are you okay? Can you talk to me about it? Even just opening up, saying, talk to me, tell me more. So ask those questions, be direct. And this is something we do a lot in our training at SADAG, is getting used to asking people direct questions. Do you have a plan to end your life? Do you have thoughts about suicide? Do you have thoughts about killing yourself? Don't be vague, ask direct. It gives you more information as to what that person is thinking. They might come back and say, yes, I've actually been thinking about ending my life for a long time. Asking honest questions and open questions can give you more info. Some of the things you can do for listening and active listening skills, and it could just be, tell me more. What has been happening? Some of the key tips of what to avoid asking or saying when you're speaking to someone is not saying, but why do you feel depressed because of your parents' divorce? That's got nothing to do with you. Sometimes avoiding the question why, but more like, how are you feeling? How does that make you feel? And it sounds really difficult. So reflecting is really good. And that's where it comes in that active listening, connecting to help, in that you don't have to do this yourself. You don't have to fix everything. And this is kind of some of the information that we as SADAG can equip you with. And that's why we're going to give you our details at the end of this, including our email addresses, that we want you, whichever school you're at, to say, hey, I'm from this school. Tell me what resources I have in this area. And remember, you as a teacher, an educator, parent, you have access to a 24-hour helpline. If you've got a student who, for example, doesn't have food, or needs to be linked to a social worker, or needs to be linked to a shelter, or you're not quite sure which school district team or what resources are available that are provided, we can help connect you to that. So again, we've just made your circle bigger. When you're trying to connect someone to help, and you as a teacher, educator, again, you don't have to fix the problem, but you can connect them to the resources to do that. Again, SADAG's helpline, which we'll share the number. It could be a psychiatrist, a GP, someone in the community, a psychologist, a social worker, a counselor. There are also counselors at police stations. I saw the comment about church counselors. Absolutely, there's youth groups, church counselors available. There's lots of NGOs in communities that provide help and resources for youth and young people. Find out what is available in your area or the area next door to you, and they're always willing to help. Sometimes reporting or getting a teacher or a team member within your school to help you as well, so that if you need to be with the learner and to chat with them, because you don't want to leave them alone, you can have the HOD or an LO teacher or counselor actually able to assist you and help you with making phone calls, getting more resources, again, looking at connecting to help. A parent or a guardian. And as Alexa mentioned earlier, sometimes a teenager is really afraid to tell their parent. They feel like parents aren't going to understand. They're going to be very ashamed of them telling a teacher about the problems of what's happening at home. Sometimes parents can be the cause of why someone is feeling depressed or causing abuse. So finding an adult that they trust. It could be someone from their church, it could be an aunt, an uncle, it could be an older cousin, or even a sibling. And this is where you could ask, who do you feel I could speak to? Who can we reach out to? Knowing the resources for your hospitals and clinics, and we spend a lot of time on this. You can't just assume that the clinic in your area has a psychologist or a social worker. And we do a lot of work in phoning all the clinics and hospitals around the country to make sure, what day does the psychologist visit your clinic? How do we go about making an appointment? So we can definitely help you with getting those resources in your community. We also know that we don't have enough mental health resources, enough psychologists, enough hospitals. However, there's also a lot of additional help. It could be in an area next door to where you stay. It could be nearby. And again, wherever you are, you have access to the SADAG helpline, where we can provide counseling and action plan over the phone. This is something that we can share, and we have a great post, and we've left it blank so that you can use this as a starting point, as a support directory. Knowing, again, your nearest hospital, the social worker department, the psychologist department, casualty. This is just a really great resource that every teacher and every school should be putting in place. Every parent should be having in place so that you can fill in these details. Having the SAPS emergency number is very useful, but having the direct number to your police station and finding out, do they have a victim trauma unit? Do they have counselors? What kind of resources are available? So when you're in emergency, you know who you can contact. When someone is thinking about suicide, it's very normal to have a human reaction and to get a bit overwhelmed and not sure how you're going to fix it, how you're going to help, what to say. This is just a really helpful tool. Again, you can print this and put it up in your notice boards in your classrooms and refer to it if you're ever in that situation. As mentioned, and Alexa gave a really great guideline on her suicide safety plan. And this is just a simple template, again, that we'll be sharing in the manual, that I think every teenager, whether they're feeling depressed or suicidal, should even be following and having, because we've all had down days. We've all had difficult moments, and in a COVID world where our depression and anxiety levels have just increased that much more, we're needing to have to build our resilience and our support circles. So looking at these different elements, and I'm going to show you, we have a template that you're able to print and actually give it to learners or use in a situation when you're sitting with a learner who's opened up and said, I'm really not coping, I don't know what to do. This is a really great place to start, so that if you have to leave them and they have to go home and you're not sure what's going to happen on the weekend, they've got something that they can refer to when they're feeling down and out. Talking about my distractions, putting together a specific list of your safety support. Then looking, how do I look after my own physical safety in that moment when I'm feeling depressed or down? My stay safe rules, my reasons for living, and my visual prompts. So when we're looking at this, is my safety support is that if things feel like it's getting too much and I can't distract myself and I need self-help and I need to reach out to someone, who can I rely on in that moment? It could be a parent, it could be a sibling, it could be a cousin, it could be a best friend, it could be the parent of a best friend. It's really listing that. So when you're feeling down, that teenager, that learner knows who to contact and where to go, and to reach out and say, hey, I'm activating my safety support. I'm really not coping. Can you help me? And if you get that call, is then able to be there for that person. Distractions. And this is something, especially when you're feeling down and you're stuck with those thoughts and you're stuck in your situation. And we do this a lot with our callers that call in every day, is we find what can we use to distract, whether it be leaving the room, whether it be going for a walk around the block, whether it be going outside just to get some fresh air. So putting in and brainstorming with the learner, if you're having bad thoughts or you're feeling really down, here is a list of things that can distract me and things that they enjoy. It keeps them busy. And I think it's really important. We've put in 5 there, but if they want to put a list of 10 things that they could try, I think that's also really important. My safety. If I don't feel safe right now and I feel at risk, how can I get myself into a safer environment? For example, if I'm sitting at home alone in my bedroom and I'm feeling like I can't do this anymore, what do I do? And I think it's about, okay, so leaving the room, going outside, phoning my best friend, speaking to an adult, going to speak to the teacher. It's really looking physically, how do we actually ensure their safety? It could be taking things away that I would use to hurt myself, locking the door to the medicine cabinet, whatever it's needed. And I think it also gives you more insight into what is going on in the learner's life. My stay safe rules. So now that they've done all of these different steps and they're feeling a bit better, it's also really important that we keep them safe and that they stay safe. So in that moment, when some of those really difficult and strong feelings of suicide have subsided, it's getting them to support. So who can they be with? Who can they activate and say, hey, I've actually just had a really bad afternoon. Can we just chat about it? And I think, again, listing those people, whether it be playing with the dog, whether it be speaking to a teacher, whether it be speaking to a parent or a friend, or even a counselor at SADAG. Again, for learners and people in remote areas, is to let them know that if they've got access to a phone or a public phone, that they too can get help. And that's literally just a phone call away. Some of these things that, again, it helps them to stay busy. It's something that they could focus on. It's these visual prompts. What resonates with them? And teenagers who perhaps don't always have the language to express how depressed they're feeling or how they're not coping or why they're battling to manage their problems in their life. I think it's about visually finding different ways that relates to them. Song lyrics. We know teenagers love music, poetry, writing poetry, even a quote that really resonates with them. Having this in one place, they kind of stay safe. Their visual prompts so that they can go to and look at and feel lighter, to help them keep calm, to help distract them, to help remind them that it's going to be okay. And I think it could be pictures of loved ones, pictures of things on their vision board or things that they want to do. It could be drawing, art, journaling. Again, putting it together with what suits that person in that moment. It could be a box of things that keep them calm. So perhaps they could have things. It's listening to their favorite music, being able to go sit outside in nature. Again, finding out what works for that specific person. A list of reasons for living. And I think, often when you're dealing with someone who's really down and feels like there's no reasons, starting off small and saying, okay, but what do you enjoy? What what brings you meaning in your life? What relationships do you hold closely? For example, your best friend, memories that you've had. Again, just having a list could be an activity that could help distract them from feeling so down and overwhelmed and thinking that the only way out is to end my life. It's to give them, again, purpose and let them know that they matter. It could be things of what they're good at. Maybe they're really good soccer players. Maybe they're really good at singing. It's listing that to remind them. Often when someone is deeply depressed and feeling really down and thinking suicide is the only option, they forget all these reasons. And sometimes having that go-to list to read and remind yourself can be very powerful. I think, again, when we're ending all of these up, is that if all of these distractions and activities have not helped, and that the person is still feeling down or suicidal or depressed, is to definitely activate their support contacts and to speak to someone. Or they can even call a counselor at SADAG 24 hours a day, toll-free. We often have many teachers who perhaps don't have all the answers, don't know how to help a specific situation, but they say, hey, let me help you get help. And they actually go and use a phone at the office, use their cell phone, encourage the learner to use their phone and say, I'm going to sit with you. I'll call them for you. We'll dial the number together, but you speak to them and let's do this together. So having this number and leaving it up in your classroom, I cannot tell you how often we have a learner that phones us and says, I've never noticed this poster, but last week I actually saw this number in the classroom and I thought I need to speak to someone. So don't underestimate all those wonderful posters and information. Write it on your board. You never know when someone will need it. Some resources. And this is where SADAG comes in, is that these resources are readily available, and we'll include this as part of our toolkit that we emailed to everyone that registered for this afternoon's webinar. We have brochures that outline the signs and symptoms, the warning signs, the different causes, what to say, what not to say. We have different posters that you can put up in your classroom, around your school, on your notice board. Helpful numbers, helpful things to look out for, helpful conversations to have. We also have an online toolkit currently on our website that includes videos, posters, articles, and helpful resources for teachers and educators and parents around the country. There's also a list of some helpful apps and websites that we can share with you, whether it even be messaging a counselor at SADAG on our WhatsApp helpline. That could also really help. We've also got previous webinars and manuals. Last year, we hosted a webinar about suicide shouldn't be a secret. That webinar link will include, it is listed below, and we'll make sure that everyone has access to this so that you can share with your other teacher friends. You can go and watch and refer to, or you never know, when you come across a child who needs help, you'll have these resources at your fingertips. These are just some of the posters that we have around myths and how to contact us. We are going to be sharing an evaluation survey that we're going to send to everyone, because we really want to know what kind of help you're needing and what you thought of today's webinar. And if you're wanting posters, please let us know and we will make sure to get them to you so that you can put them up. Some of our social media handles, and this is not because we want followers and to increase our following. It's because we share on a daily basis videos, articles, helpful resources, helpful activities or information that's going on. So please, if it's not you or you encourage your learners to follow us on social media, it's really important because the information we share could literally save a life. Here, and this is a time that you can absolutely screenshot this. You can take a photo. We are going to email you the poster so it'll be easy to print, is that you can actually remember and give out these numbers whenever, however, whenever you need to. Sometimes being a call away, just letting someone know that they don't have to deal with their problems by themselves, and that there's someone that has access to resources and information that can help come up with an action plan is really useful. We've also listed there our WhatsApp chat line, where we have counselors every single day from 9 to 4 who chat live via our WhatsApp number. Our helplines are 24 hours a day. People can phone, it's free from a cell phone or a landline. And we've also got an SMS. So if someone is not able to phone us, they can SMS us and we will call them back. What I'd like to do now, and coming to the end, and I see the chat box is going really, really busy. I'm going to just come to one of our final polls before we ending up, which is already after 4. Here are 2 important email addresses to keep on hand, as if you're needing information or you need help with a learner that has a difficult situation, please email us directly. I've got my colleague Pietri, whose email address is there, as well as my own. Please, we want to engage with you. We want to know what extra help you're needing. So keep these again. This is when you screenshot. This is when you keep it available. We've also listed some really helpful websites and apps that you can also go to. It's also not a bad idea for educators and teachers to try these out and practice what you preach. Plus, it's also really important for self-care and to look after your own mental health so that you can look after others. I'm just going to come to our last poll. There's so much information that I know that we need to touch on and tackle and unpack. And if you bear with us, this is something that we want to do as part of a series. There's a lot of information we have available, and the questions have been really useful, and we will get to them, I promise. I just really hope that today you were able to learn or take one thing back that could help you in your classroom, your own life, or with your child, or with a learner that you're worried about. And if you've taken one thing, then that's really good. I'm just going to put up our next poll that I'd really love your feedback for. And let's just get that. We just really want to know that from today's webinar, from a scale of 1 to 10, 1 not good at all, to 10 being excellent, was this webinar helpful? Were you able to take one thing home with you that you can use in daily life? And will you be visiting us again? So please do let us know 1 to 10 how you found today's webinar. We'd love to hear from you. Just some of the questions while everyone is filling in the poll. Do we offer counseling courses for teachers and individuals? We actually do provide information. We don't have an accredited counseling course, but one of the webinars we do want to do is really unpacking compassionate counseling skills and active listening skills. So watch this space. We will send you more details. A good question here from Khonse, are the tools printed only in English? No, we have them in various languages. We also have brochures on substance abuse, trauma, depression. So we have posters in different languages and materials in different languages. So please do, Khonse, please make sure to email us and we can make sure that you get all of those details. Thank you. I hope everyone can also travel safe, and thank you also just so much for joining us this afternoon. I really appreciate your time. Please watch this space as we share more information in the coming weeks. We will be sharing this recording as well as all the presentation slides via email. We'll also be sending an evaluation link where we just want to learn a little bit about what you're dealing with at your school, the kinds of help and support we can provide, and just knowing what we can do better for next time or what topics you want us to cover. So please look out for that email tomorrow. We'd really appreciate your feedback. To everyone that's joined, thank you so much. Have a wonderful afternoon, and thank you for your time. Thank you. Bye-bye. Thank you.